Sunday Beauties. My name is Dr. Stephanie Keppel, and I'm a cosmetic dermatologist and laser specialist in Newport Beach, California. And I'm just taking a quick break. It's a beautiful day at Fashion Island in Newport Beach, and I wanted to take a minute to film this very short but hopefully effective YouTube video. So another dermatologist recently posted active ingredients that you have to avoid while using a retinol. And I just want to make it clear that I'm happy that there's a lot of board certified dermatologists now on YouTube, and a lot of doctors are getting on social media, but I don't want you guys to stress out or freak out if there's two board certified dermatologists that have conflicting recommendations. For example, some may like microneedling, some may not. Some may like exfoliating, some may not. Some may like oils on the face, some may not. So we're each a product of our residency training, what we see day in and day out with treating patients in our clinics, and keeping up to date as lifelong learners in our continuous medical education through academic meetings and board recertification and things of that nature. So I really encourage you guys to follow board certified dermatologists, but I also at the same time don't want you guys to get confused or feel overwhelmed when the two of us are saying different things. And I feel that in a world of social media, I think it's important to get education and follow providers who you know and trust, who take their advice and that works for you. And if you don't vibe with that person, then that's okay. But just know that you're going to come across two, dermatologists in the same field that may have conflicting things to say, and that's okay. It's not supposed to be a stressful situation. So on that note, using a retinol, the only active ingredient that is really contraindicated in using is a benzoyl peroxide, because that's an oxidating active ingredient which can actually counteract the effects of a retinol. So you want to avoid benzoyl peroxide and retinol. That's absolutely true. That actually is a question on our dermatology boards. I remember that one, and something that we learned for our board preparation. But certain active ingredients like beta hydroxyacids, even alpha hydroxyacids, or like vitamin C, L-ascorbic acid, many of the medical grade skincare lines that are well respected in the field of dermatology, like Zio Skin Health, Skin Better Science, Skin Medica, use alpha hydroxyacids, ascorbic acid, and retinol in the same treatment protocol, morning or night or both. So it's absolutely okay. It can increase sensitization, but that's very patient dependent, and especially for people who are newer to the skincare game and more elegantly formulated, maybe stronger medical grade skincare, it would be a little bit irritating. But even if you've been using a certain medical grade skincare and you're trying something new, it's good to just ease yourself into it and not do too much too fast. And I think that will minimize sensitization, build up a tolerance, and get your skin healthy on a cellular level at weeks after weeks after weeks of use. So although it is true it can be more sensitizing or potentially more irritating if you use a retinol with a BHA or L-ascorbic acid, that doesn't mean that you can never use the same together, because I've been using those two products together for decades and I have not had an issue for it, with it. And I'm in my 40s now and I've been doing it since my early 20s, and I'm glad that I have. And patients who I see day in and day out in clinic, are using, especially even my skincare line, which I formulated myself, which we just launched this year with medical grade formulations and next level delivery systems. I have a retinol and a vitamin C, which contains an L-ascorbic acid, and my patients, hundreds and even thousands of patients, are using it now, having beautiful skin and not having the sensitization or the deleterious negative side effects from using those two active ingredients together. So just food for thought. Just wanted to jump on here really quick and just do this quick video post on just reminding you, benzoyl peroxide, retinol, you don't want to mix those together, but L-ascorbic acid and AHAs and BHAs are fine to use with the retinol, especially if you're easing yourself into it and not doing too much too fast. All right, you guys, I hope this helps.